My name is Kirtan and welcome to my channel Physiology at Once. Today I will be talking about the topic anemia. Anemia can be basically defined as the decreased red cell count or hemoglobin content of blood. It can occur due to many cases like iron deficiency, sickle cell anemia, blood loss, aplastic anemia and many more cases. It can be detected by estimating hemoglobin content of the blood, estimating the RBC count, and estimating the plaquet cell volume or hematocrit. Hematocrit is nothing but the volume of the RBCs in the blood. Clinically, it can be detected by checking the paleness in the lower palpebral conjunctival and the nail beds. So let's classify the anemia. Anemia can be classified into morphological and etiological. Morphological, it is hypochromic microcytic anemia, normochromic normocytic anemia, macrocytic normochromic anemia. And in the etiological, it is hemorrhagic anemia, hemolytic anemia and aplastic anemia. Let's talk about this in detail. First, talking about the morphological classification. It can be classified into three types mainly. The first one is hypochromic microcytic anemia. Hypochromic, chrome means color. So when it's hypochromic, it is caused due to the decreased level of hemoglobin in the blood, because hemoglobin gives the color of the blood. So hypochromic, microcytic means the decrease in the size of the red cell. So the MCV will be decreased, MCH or mean corpuscular hemoglobin also will be decreased, and MCHC, mean corpuscular hemoglobin concentration, also will be decreased. This occurs mainly due to the result of RBC formation, in which hemoglobin synthesis also impaired. The common examples in this case is iron deficiency anemia and thalassemia. Thalassemia can be also divided into alpha thalassemia and beta thalassemia. Now coming to the next one, normochromic normocytic anemia. Normochromic means the hemoglobin will be normal, normocytic and the RBC also will be normal. So MCV is normal, MCH is normal, MCHC is also normal. In this case, it is usually caused due to the blood loss anemia, hemolysis or aplastic anemia. Aplastic anemia is nothing but the deficiency in the bone marrow due to which the production of RBCs is decreased. Coming to the next one, macrocytic normochromic anemia. Macrocytic, there is increase in the size of the cells. Normochromic, the hemoglobin will be usually normal. MCV is increased, MCH is increased and MCHC is normal in this case. We can take the example of megaloblastic anemia in this case, which also occurs due to the deficiency of vitamin B12 or folic acid. Now let's talk about the etiological classification. Under the etiological classification, it can be divided into hemorrhagic anemia, hemolytic anemia and aplastic anemia. So let's talk about the hemorrhagic anemia. It can also be divided into two parts, acute hemorrhage and chronic hemorrhage. Acute hemorrhage, reduction in the blood volume, depends on extent of blood loss and bleeding time that has lapsed since bleeding. Becomes normal after some time because of compensatory mechanism. So the compensatory mechanism acts in this case, which regulates the blood loss and it's acute. Chronic hemorrhage, it occurs mainly in the GIT, genitourinary and respiratory tract diseases. It is the internal hemorrhage or internal bleeding as you can call it, and no compensatory mechanism cannot regulate it to an extent. Let's talk about hemolytic anemia. This is due to the decrease in rate of red cell destructions and can be due to many causes like intrinsic anemia and extrinsic anemia and intrinsic anemia. In extrinsic anemia, it is destruction by external factors. The common causes are liver failure, renal disorder, burns, hypersplenism. Hypersplenism, you can take it as because the spleen is the graveyard of RBCs, so the destruction of RBCs will be more because there is increase in the size of spleen. In intrinsic anemia, there is destruction due to the defect in the RBCs. It is mainly inherited like sickle cell anemia and thalassemia. The cell membrane of the RBC is degraded in these cases. Talking about the aplastic anemia, it is due to the impaired red cell production. In this case, the red bone marrow is reduced and replaced by the fatty tissues. The common causes for the aplastic anemia are X-ray radiation, tuberculosis, and viral infections like HIV. This destructs the red bone marrow slowly and causes the aplastic anemia. Here the RBCs are normochromic and normocytic as we discussed it before. Now let's talk about the common anemias which occurs in people. The first one is iron deficiency anemia, also known as IDA. It occurs due to the deficiency of iron in the diet, which is more commonly seen in India. The three major factors affecting the iron deficiency anemia are increased physiological demand, inadequate iron intake, pathological blood loss. In increased physiological demand, it occurs in the case of pregnancy, growing children, and lactation. In these cases, there is increased requirement of the iron. In the case of inadequate iron intake, it occurs due to the deficiency of iron in the diet, which occurs in the developing countries like India. In pathological blood loss, it occurs due to bleeding peptic ulcer, piles, and epistaxis, in which the blood is lost and iron is also lost. Talking about the next common case of the anemia, it's sickle cell anemia. It actually occurs due to the abnormal HB present in the RBCs. It is actually inherited. In this case, there is the replacement of glutamic acid in the 6th position of beta chain by the valine. The molecules of HBS polymerize and change the shape of the red cells into sickle shaped, which decreases the deformability of the RBCs and causes easy rupture of the cells. This causes intravascular hemolysis. This is an autosomal recessive disease. In children, hemolyzed sickle cell anemia aggregate and block the vessels, leading to infraction. This is a major condition which can also cause us to death. Now talking about the next common anemia, it's thalassemia. As I told before, it can be divided into alpha and beta thalassemia. In alpha thalassemia, there is decreased alpha chain of HB. You may be knowing that HB contains alpha and beta chain in the normal adults. Due to the decreased production of this alpha and beta chains, it causes this kind of thalassemia. In beta thalassemia, there is decreased beta chain and increased alpha chain of HB. It is mainly a genetical disorder and it is due to the abnormal production of hemoglobin. If you found this video informative, please like, share and comment, and also subscribe for more videos like this. Thank you.